Meniscus is a very important structure in your knee joint, and meniscal root tears and meniscal tears are very common injuries around the knee joint. So these can occur by various modalities. They can happen in road traffic accidents. Very commonly they can happen in sports injuries, and also as the age progresses they can as well occur as degenerative meniscal root tear. So this is our normal knee joint. So this is the patella bone, and this is the thigh bone, and this is the leg bone. So between the two bones is our knee joint. So when we see inside the knee joint, this is called the cartilage. So this cartilage is very important for the normal functioning of the knee joint. So these two structures, C-shaped structures, curved structures, are called menisci. So these menisci actually they provide very good shock absorbing effect, which will protect our knee joint in the form of protecting the cartilage. So these meniscal injuries have become very common these days because of a lot of increased high demand activities like sports and also high velocity road traffic accidents. Also with increasing age, the degenerative process which happens in the knee joint as a part of osteoarthritis, the menisci also gets damaged and generally get torn. These are called degenerative meniscal root tears. So for you to easily understand, we have removed the thigh bone and we are just showing the knee joint in the form of the leg bone, which is called the tibia, and also the two menisci. So this is called the lateral meniscus and this is called the medial meniscus. So these meniscus are very commonly injured in road traffic accidents, high velocity trauma like sports injuries, and also with increasing age. When this is called the posterior root of the meniscus and this is called the anterior root of the meniscus. Likewise, this is called the posterior root and anterior root of the lateral meniscus. The posterior root of medial meniscus is very commonly injured in all sorts of injuries and also as a part of osteoarthritis. Traditionally, when this meniscal root is injured, we consider it as very important because once the meniscal root is injured, the degenerative process accelerates and the meniscus will, the tear in the meniscus will cause rapid acceleration in the osteoarthritis progression. So in order to avoid this and to stop this progression, we always try to repair the meniscal root, particularly in young people in whom the joint is not completely damaged. So whenever this posterior root is torn, traditionally we used to repair it by a transtibial tunnel technique where we used to drill a long tunnel in the tibial bone and we used to take suture bites in the meniscal root and we used to pull the sutures through the drilled tunnel and we used to tie it over the tibia. So the meniscal root is here, the tear is here, and we actually are fixing it here, which is quite far from the actual tear. So and also when we used to drill the tunnel, we used to drill at least 4.5 mm to 5 mm diameter of tunnel, which is quite big. So now we are going to discuss about a very novel anchor which is called RootFix anchor by OsteoCare, which has many advantages when compared to the traditional transtibial tunnel technique repair. So first of all, this is how we get it, the entire, we get it as a kit. So this is a very nice implant where, and the way they provide it is very useful because once we get the kit, it is very easy to handle everything stepwise. So this is actually 2.3 mm drill bit where we use to drill a tunnel in the tibia, and this is the actual anchor. This is an all suture anchor of 2.3 mm diameter, and these are the suture materials which are used to take bites in the meniscal root and also to repair it. This is again suture material which is used to actually tunnel the anchor into the drilled hole. All of these are made up of ultra high molecular weight polyethylene, also called as fiber wire material. This is the cannulated sleeve. I'll just explain how we use it as well. And this one is this is called the wire loop, and this is called the lupin fiber. Lupin fiber as such, it is actually fiber wire, a loop at one end, which you can clearly see. There is a loop at one end and there is a normal sided end on the other side. And generally we use these kind of specific meniscus side specific jigs which are called meniscal root jigs. These are used to drill the tunnel exactly at the location where we want, that is the meniscal root footprint. And there are other instruments available with OsteoCare as well, come very handy when we do the root repair. And this is called Python Mini, which is actually a direct suture passer. This is a direct suture passer. which can be used to take the bite through the meniscus like this. And this is the regular suture retriever which can be used in the process of this repair. So now we will go into the actual procedure details so that we can understand how to utilize this RootFix anchor to fix our meniscal roots. So initially when we drill the tunnel, here the tunnel is already drilled, but this jig is used to place tunnel where we use, so this is how we drill the tunnel using the jig. We place the jig where we want the tunnel to be prepared, and then we put this bullet and we drill it with the 2.3 mm drill bit. All we have to do in this procedure is drill the tunnel with a 2.3 mm drill bit. Traditionally in the transtibial technique, we used to drill with a 5 mm or 4.5 mm drill bit, which is a cannulated drill bit, but this is just a 2.3 mm drill bit. So there is much less bone loss in this particular type of repair. So once the tunnel is drilled, we take everything out and then we use cannulated sleeve as a guide to put in our metal loop. So once we get this loop inside the joint, we try to pull this loop out using a suture retriever and then we remove it. So once the suture retriever is out of the portal, we use this Loopin fiber and we shuttle it through the tibial tunnel. So why did we use this Loopin fiber is we found that metal loop many times when we pull the anchor can break. So once it is break, again we have to go through all the process once again. So to avoid that, we started using this Loopin fiber where the straight end is looped and it is brought out from the tibial tunnel like. So once this is here, now we have a fiber wire with a loop in the portal. Now we actually try to shuttle this suture through the Loopin fiber. So once we shuttle these are put inside the Loopin fiber, we try to shuttle these through the tibial tunnel. So now we have this guiding wire, the soft tissue anchor and the suture threads attached to the anchor. So now retrogradely we pull the anchor into the tibial tunnel. So once the anchor enters just below the tibial subchondral bone for about 15 mm to 20 mm inside, and it is deployed. Once it is deployed, it cannot come this way and these pulling sutures can be completely removed. So now we are here with the anchor deployed and the suture material. So we try to use a cannula to alternately put these sutures into the meniscal root tear. So generally we use the beautiful thing in this particular root anchor is these are zero fiber wire. So zero fiber wire are very thin fiber wire which can be used to repair this meniscal root, and when we knot it, we get a very low profile knots. Low profile knots are very important in order to avoid cartilage scuffing postoperatively. So we take bites through the root anchor in this manner. We can clearly see that this is a direct suture passer which can bring the suture material outside in this way. So we try to pair it in the form of a modified Mason-Allen stitch pattern so that the pulling strength will be much higher. So number 2 goes in and number 3 goes in. Okay. So once all these are here, all we have to do is we tie knots, arthroscopic knots, because it's not open like this in the surgery. So during surgery, we have to use these to tie knots through the cannula. So there are specific instruments for this. This is called a knot pusher, where we use it to tie the knot securely over the repaired meniscus like this. So we put 1 or 2 knots and then through the same cannula, we cut the knots closely. So in the similar way, we put the knots for the other pair of sutures as well. So this is how it is repaired. Okay, so what are the main advantages of this particular RootFix anchor from OsteoCare? So the first important thing is we just drill a tunnel with a 2.3 mm drill bit. So the bone loss actually in the tibia will be minimal. Number 2, the suture threads are not in the tibial bone. They are actually fixed just beneath the root tear. So the fixation is much superior than fixing it far away from the actual root tear, like we do in the traditional transtibial technique. Number 3, the suture materials are not in the bone, and so we can use this particular repair technique when we do concomitant ACL reconstruction or high tibial osteotomies, where we put screws in this part of the bone. So when the suture materials are present in this part of the bone, the implants can definitely damage this tunnel and it can cause tunnel coalescence. So these three are the main advantages of this particular root anchor. So when compared to regular transtibial technique, the fixation is superior, and there are multiple advantages of this particular RootFix anchor, where we can use it along with other procedures.